Are squats and lunges your enemy, causing more pain than gain? You're not alone. Many people struggle with these powerful exercises, but a leading vascular surgeon, Dr. Sumit Kapadia, is here to reveal the secrets to performing them safely and effectively. With over 18 years of experience, he's seen firsthand how improper form can lead to knee pain, back strain, and even serious injuries. But here's the exciting part. Dr. Kapadia's expertise can help you unlock the incredible benefits of squats and lunges without the risks. This isn't just about avoiding pain. It's about maximizing your results. Squats and lunges are fantastic for building strength, improving balance, and sculpting your lower body. However, Dr. Kapadia emphasizes that proper technique is absolutely crucial for protecting your joints and getting the most out of each rep. Why does form matter so much? Think of your body as a finely tuned machine. When squats and lunges are performed correctly, they target the right muscles, glutes, quads, hamstrings, and calves, while safeguarding your knees, hips, and spine. But when your form is off, the stress shifts to vulnerable areas, significantly increasing your risk of injury. Dr. Kapadia points out that many people go through these exercises on autopilot, without paying close attention to their alignment. And this is the part most people miss. Simple self-checks can dramatically improve your workouts and prevent long-term problems like knee valgus, knock knees, or chronic lower back pain. The easiest way to improve is to observe yourself from the side and front, either in a mirror or by recording a video. That visual feedback is invaluable. Squat mistake number 1, the knee cave-in. This is arguably the most common squat mistake, and it's a big one. When your knees cave inward as you lower into the squat, you're overloading the inner knee and hip joints. Dr. Kapadia explains that this misalignment throws off your balance and sets you up for potential pain and instability. Imagine your knees drifting towards each other. That's a red flag. The fix? Keep your knees in line with your toes throughout the entire movement. As you descend, actively push your knees outward, tracking them over your toes. Think about sitting back into a chair, keeping your weight evenly distributed. Start with bodyweight squats to practice this technique, focusing on controlled movements. Squat mistake number 2, rounded back and leaning too far forward. Another frequent error is rounding your back or leaning excessively forward during the squat. This shifts your torso forward, placing undue stress on your spine and toes instead of engaging your leg muscles. According to Dr. Kapadia, this is a major don't because it compromises your core stability. The solution? Keep your chest lifted and your back straight, maintaining a neutral spine. Imagine a string pulling your head upwards. Keep your weight over the midfoot. Lower yourself until your thighs are parallel to the ground, or as low as is comfortable, and then drive back up through your heels. Remember to engage your core for added support throughout the movement. This will protect your back and give you more power. Lunge mistake, the forward slouch. Lunges often go wrong when the front knee extends past the toes or when you slouch forward, disrupting your balance and straining the knee joint. Dr. Kapadia emphasizes that the main culprits are slouching and/or moving forward incorrectly. The key to proper lunge form is controlling the front knee, keeping your back and core straight, and lowering your body vertically. Take a controlled step forward, ensuring your front knee stays aligned over your ankle. Lower yourself in a curtsy-like motion, keeping your front knee above your ankle and your back knee just above the ground. Maintain a tall torso and gaze forward. Push back to the starting position without using momentum. Pro tips for safe and effective practice. Here are Dr. Kapadia's top tips for maximizing your results and minimizing your risk of injury. Record yourself, stand in front of a mirror, or have someone video you, he advises. Review the footage from all angles, side and front, in slow motion. Make adjustments. Widen your stance if your knees start to cave in. Remind yourself to keep your chest proud if your back starts to round. Start light. Begin with bodyweight exercises to master the form before adding weight. Warm up properly. Always include dynamic stretches like leg swings in your warm-up. Progress gradually. Aim for 3 sets of 10 to 12 repetitions, increasing weight or reps as you get stronger. Breathe smoothly. Inhale as you lower, exhale as you rise. Listen to your body. If you experience persistent pain, consult a healthcare professional. By mastering proper form, you'll unlock the full potential of squats and lunges, strengthening your glutes, quads, hamstrings, and calves. Consistent practice will also improve your posture, mobility, and metabolism. Dr. Kapadia's guidance ensures safe and effective gains. Film your next set, identify any areas for improvement, and feel the difference. And here's a final thought. Strong legs support heart health too, which is vitally important in Dr. Kapadia's field of vascular surgery. So, are you ready to ditch the pain and build a stronger, healthier you? Now let's talk. Do you agree that proper form is the most important factor in exercise? Have you ever experienced pain from squats or lunges due to poor form? What are your favorite tips for maintaining good form during these exercises? Share your thoughts and experiences in the comments below. But here's where it gets controversial. Some people believe that pushing through the pain is necessary to build strength. What do you think about this viewpoint? Is it ever okay to ignore pain during exercise?